Okay, welcome everybody. I know it's an unusual time to get together, but we're working with our special guest speakers coming from Australia. So we have a 14-hour ahead of Eastern US time to deal with, and they've got up bright and early to join us. And so Dr. Rob Marshall, Tailai O'Brien, they have written this unbelievable, encyclopedic, dense, overwhelming, it will take you multiple lifetimes to ever even consider reading it, book about the Eclectus parrots. So if you guys have an Eclectus parrot, that's probably why you're here today. And we'd love for you to put that in the chat as well. Let us know about who you have. And, while we wait for the questions to start, Dr. Marshall and Tailai, why don't you tell us a little bit about your book and why people with an Eclectus parrot should consider buying it?
Thanks, Stacey.
Yep. So to begin with, this project taken 20 years for us to put together this book. It's a culmination of working with behavior, working with hand-rearing birds, working with wild parrots in the wild as well, and obviously the medical side. So we've worked together on it for the past 20 years.
Tailai and I work together in a clinical practice. I rely on Tailai to explain to me things that I found as a veterinarian I had no deep understanding of, especially behavior. I think there's limitations to a single brain working out these problems, and the other brain needs to be non-medical. And Tailai has an extensive knowledge of animals, growing up on a farm and rearing her first rabbit at the age of 3, so hand rearing. So although hand rearing is a sort of issue at the moment, we found that we got a lot of information from hand rearing birds. Our main concern or our interest was on the digestive function of the bird. As you know, with humans, gut function, brain function are intimately involved. And so I wanted to investigate as a priority the gut function of this parrot, which is a unique parrot. As we know, it's quite interesting because we gave a paper to AAV about the intermediate zone of the eclectus stomach. Susan, it was quite funny because I read a previous paper, I think it was in the 90s, which was I found this paper which described the intermediate zone as a stomach hernia of the eclectus parrot. Now, which was really interesting to me. And that's the nature of this stomach of the Eclectus parrot. It's a unique part of the stomach, the intermediate zone. And it took me a long time to work out what the function of that was. And I relied on a few people around the world, but most importantly, I relied on Tailai's hand rearing of these birds and introducing different foods at different developmental stages of the stomach to see how they responded to this process of moving away from a liquid diet and introducing a solid food from a very young age, from 2 to 3 weeks of age, and saw that the change in brain function of these baby birds changed from that very young age. So we then, and in this section, there's a big section on hand rearing. The reason that I've given that big section is to describe the developmental stages of baby birds, and with the understanding that the stomach develops from a very young age, and if we don't give the right foods for that developmental stomach development, and especially the development of the gizzard in relation to the intermediate zone, we get weaning problems. When weaning, by what we term weaning, which is really incorrect, is moving to feeding self-sufficiency, which in the Eclectus parrots happens between 11 to 12 weeks. But often when you hand rear an Eclectus parrot, we're not seeing moving to feeding self-sufficiency until 16 weeks. So, and that's a key period from the 12 weeks, 11 weeks to 16 weeks is a key period of brain development and behavioral development. What do you think, Tassie?
Yes, and even just from the earlier period, even back to the 2 weeks, introducing those foods from a very young age. And we have photos of even 4-week-old Eclectus eating from a bowl, nibbling from a bowl. And it's that sort of thing that triggers this bird is going to be more open to its environment down the track and more mentally aware of everything that's going on. Its brain is opened up from that young age rather than just being pulled out of the cage, fed, and then put back in. It's like its brain is being pushed from a young age.
So
that's why it's so important to us.
So Tailai taught me a really important thing, is that I asked her, well, what's happening here with the brain, right? And she says, it's because the parrot is starting to chew and use its tongue and jaw, right? So can you explain that to us?
Basically, what I mean by that is you're actually opening up different pathways in the brain that wouldn't be opened up if you were just allowing the bird or prop feeding the parrot. So basically we need to have the bird so it starts to use all of its physical senses and everything like that, so it's interacting with its mother as well if it was in the nest. So we're kind of trying to replicate what's happening in nature, basically, to ensure that we have the strongest and most intelligent bird at the end. That's the idea of it.
And the key thing for chewing is the movement of the tongue, right? And the tongue is key to language, right? And so what we found is we're finding that these birds were talking at what age, Tassie?
Oh, we have them saying hello from probably 10 weeks. Yeah, but they're actually like interacting with us, trying to say words from much younger, even from 6 weeks, and trying to get sounds out, which is what they would do if they were with their mother, I'm sure, as well.
So what we're saying is we're developing this brain from a very young age. We're developing the gut from a very young age. And Anne, as you were saying, the movement is towards parent reared birds. And this happens naturally with the parent reared birds. What doesn't really happen is the interaction of that bird with the human being, which then has implications, doesn't it?
Yeah, so I think in that case, we need to look at how the parent reared birds, what's the temperament of those parent reared birds, so that when you take the young bird from the parents, what's the new owner's expectation of how that bird will interact with them at that stage, and then is that putting that bird back cognitively because it's in quite a stressful situation, whereas if it's reared from the younger age, it's going automatically into the next stage. So that's kind of what we're looking at, and I know, Anne, that you have other ideas on that, and we're happy to discuss that.
I think most of the people listening today probably have their Eclectus from somewhere. We don't know where, we can't change it, but they want to know how to provide the best care, because as you know so well, Eclectus are completely different, especially when it comes to nutrition and gut motility, etc. So I think that's that's the chapter I immediately went to, was this nice voluminous discussion about nutrition and the components of what's necessary. So can address that in terms of
so in the book, what we've done is we've spent a lot of time in the wild collecting the fruits that were eaten, that we saw the Eclectus eat, right? So there's quite a big list of those. They're not complete because you just can't find the amount of variety of foods going up there intermittently, right? But what we know is we then analysed all of the fruits, rainforest fruits in that local area of that bird. And then in that section on wild diet, I found that pretty exciting, that wild diet section.
Yes.
We analysed the different types of foods that they ate. We also analysed the nutritional content of some foods as a means to identify what the protein levels of these foods were, which was necessary for reproductive success. So what we found is that the amount of protein in the food is much lower than in say a granivore like a cockatoo, which relies on dry foods, a concentrated form of nutrition. And how they get around it is that they eating a lot of these foods, because as a frugivore, which is a fruit-eating bird, and the intermediate zone is a key indication that this bird is a fruit-eating bird. And what we found, or what I found, was that the intermediate zone is a pre-digestive organ. What that means is that it digests fruit pulp, which is the primary part of the diet of these birds, in a rainforest fruit pulp, which is fleshy and fibrous, but the fiber in it is a soft fiber, not a harsh fiber. And so what they're doing is to make sure that they're accelerating the rate of digestion, not in the intestine. And there was a real big mistake where it was said that frugivores have a short intestine. They don't. The citizen frugivore has the intestine is the equal length of other birds. What they were referring to was a frugivore, which was a fig bird or a similar frugivore, where they're eating fruit whole, right? So they're eating the whole fruit. It's then sitting in the stomach, and I know this because in Australia there's a lot of roadkill. What that means is a lot of these birds get hit by cars and they fall on the road, and especially in Tasmania, but around Sydney. And so I'd go in my holidays on road trips and try and find freshly dead birds, and then of all different types, jump out of the car with my post-mortem kit, do a post-mortem, look at it visually, and then pop all the organs into a formalin to look at later on. So there's a big chapter here on the digestive comparative gastrointestinal tracts of all these different diet wild types. And from that, I could work out, from that comparison, work out what the difference in the Eclectus parrot is and how these functions, and worked out how it functions. Now, I also relied on a lot of research from this chap in Denmark who had done a lot of work on the chicken digestive function. And that work was pivotal to my understanding of the motility functions of the Eclectus parrot. Now, gastrointestinal motility disorders are a subject that hasn't been attended to by the veterinary profession. Susan, would you recognize that the work that has been done on gastrointestinal motility disorders is pretty new in the parrot world?
I would rephrase that to almost non-existent.
Yes, that's what I was going to say, right? So I did is,
And so it would be nice, I think, if you, when you're talking about this, there's the three parts to the stomach for the average person to understand, which is the proventriculus, the isthmus, and the gizzard. And you're saying, if I understand you right, is that that even though we list an Eclectus as a frugivorous bird, the intestinal length is longer than
it's equal length.
Equal. And as to other frugivorous birds or to granivorous birds?
As to all granivorous, all parrot species.
Okay. Yeah. And then the other thing that I was interested in is the digestion that's occurring in the isthmus, because I'm a neuro person and I'm really interested in the microbiome, so to speak. And I think that's kind of where you're going with this. And
no, not really. Okay. I know that you've got really good, because I've talked to you about the microbiome, that chap in Italy that is doing a lot of work there, right? But what I'm talking about is the paper that we presented the AAV was entitled "The Fourth Part of the Citizen Stomach," right? So, so what we're looking at, but what if we can go back a little bit? The third chamber of the intermediates of the stomach. So you refer to the intermediate zone as the isthmus, which is the traditional way of explaining what this part of the stomach is. The isthmus is a traditional way because it's described from the chicken, right? So in the chicken, what isthmus means is a narrowing. So that's what is a narrowing of this proventriculus as it enters the gizzard. So, but in the Eclectus parrot, it's actually a dilatation of the intermediate zone's dilatation. So I prefer to call this part of the stomach the intermediate zone of the stomach, right? because, and also it's pivotal if we to understand the digestive function of the various different wild types of parrots. For example, Alexandrians and the Indian ringnecks have an extended intermediate zone as well. So do Quakers, and so do conures, many conures. The macaws have a narrow intermediate zone, just like the chicken and the budgerigar, so it's called an isthmus. But the Hahn's macaw has an intermediate zone which is extended. So if we look at the microscopic architecture or the gross anatomy of the parrot stomach, we can predict the wild diet category of that bird, right? So what that means and how best to feed that bird. So the macaws, they're classified as a fat-based frugivore. That means that their core diet is the nuts of palm trees, which is a fruit. So, but it's fat-based, right? In the Eclectus parrot and in the Quakers and the conures and the Indian ringnecks, they're sugar-based frugivores. That means their core diet is based on sugar, and they then they get their fat from the diet by utilizing fructose in the liver metabolic pathway to produce fat. So their diet in the wild, frugivores' diet in the wild, is very low in fat. So what this means in the captive birds, if we can't feed, if we feed Eclectus parrots excessive amounts of fat, especially in the form of nuts, they get a condition called gastrointestinal duodenal reflux. So they get a reflux between the gizzard and the duodenum. And we know that because when we see this condition, we see green biliverdin in the gizzard of the Eclectus parrot, which is the diet of this reflux disorder, indicating that that's what's happened. For example, a macaw would normally have biliverdin in the gizzard because of the reflux between the duodenum and the gizzard in terms of fat digestion. So this is key. So if we get, and the underlying cause of many feather plucking behaviors in Eclectus and other sugar-based frugivores is intestinal pain or visceral pain associated with this motility problem. So in this book, it's got how we identify the different forms of gastrointestinal dysmotility. We've identified 4 different types or forms of gastrointestinal dysmotility disorders in Eclectus parrots and how to treat these. That's a bit on the wild diet. Perhaps someone's got any, so perhaps someone, Anne, has got some questions.
Well, I think, again, we have to remember that probably a lot of people joining us today are people with parrots, with Eclectus in their homes, captive parrots, who may not have a chance for them to get out and fly and do all the things that we would want them to do. And they're looking for the best advice you can give them for nutrition. And I'm sure we've all heard that Eclectus parrots are often in breeding mode, naturally, a good part of the year. So we don't want to be exacerbating reproductive kind of attributes either, right? So any kind of generic advice you can give to help people understand diet would be wonderful.
So basically with the feeding regime that we recommend, we like people that own Eclectus parrots to make up a soft food diet to start the day. So that usually for us, we would recommend to owners to cook up some rice, we cook up sweet potato, we cook up pumpkin, we add a small amount of greens in there, we add some carrot and all that type of vegetables as well. And then we suggest during the day that they can eat their foraging foods, and their foraging foods can include the raw foods, as long as they have that base in their stomach, which is going to allow them to digest whatever the more fibrous foods are that they're eating later in the day. Then because they're eating the more fibrous foods during the day, which is going to be those raw vegetables and the fruits and their seed mix as well, then we give another meal in the afternoon or before sunset, 2 hours before sunset at least, so that they're again getting that lining in their stomach so that overnight they can digest any remaining fibrous foods that's in their system.
That's
So that's what we would suggest.
Talia, give us an idea of fibrous foods.
So
What-
fibrous foods would be the raw vegetables, the raw greens. So things that are the foods that aren't fibrous, ones that we call more soluble foods, they're the ones that you cook up. The pumpkin, when you touch it, it literally breaks apart in your hand. It takes on the water content of the cooking, and that's what's ideal for the Eclectus digestive system, is anything that will take on that water and therefore will break down easily in the stomach. That's what creates the lining.
So what's happening is that Tali's talking about soft fiber and coarse fiber, and soluble fiber and insoluble fiber. In the book, there's a big section on that. But Tailai it was very interesting because it took me a long time to understand the diet that Tailai was developing. And I said, well, how do we know what soft fiber is, without analyzing them? And it's very simple, or soluble fiber. It's very simple in that it takes on water when you boil it, so it becomes clear. And what we're trying to do with this cooking technique, we're trying to release pectin from the food. Now, pectin is a bulking agent, and it's bulking agent which we're looking for once that food gets into the intermediate zone. We want to bulk that area out, because the intermediate zone is a big storage area equal to the crop in the Eclectus parrot. So this enables the Eclectus parrot to eat a lot of food quickly and process it quickly. But what we're trying to do is we're trying to stimulate movement in that proventriculus. As you know, with proventricular dilatation syndrome, that's a ENS, which enteric nervous failure of that area, where you get what we call gastroparesis. We refer to the Eclectus can get developmental gastroparesis. Bornavirus may be implicated in that or not, but we don't feel that Bornavirus is the cause of that problem. We think that Bornavirus is a consequence of that problem. So what we're trying to do is we're trying to develop it. We're giving a diet which stretches the intermediate zone from a young age, which is a development age of the intermediate zone, to get those nerve pathways going and the muscles going as well. So with the coarse fiber, we like to reduce the coarse fiber to a limited amount. And the bulk of the food will be the soluble fiber, because we don't want to overload the gizzard with coarse fiber. A very common cause of gastrointestinal dysmotility is feeding coarse fiber in the form of, say, kale. So feeding too much kale or coarse fibered green foods. And also the biggest thing of gizzard, we call it gizzard overload dysmotility, is the ingestion of non-food items like paper, cardboard, or things or these foraging aids that people recommend. Our foraging aids are always food substances. They're never non-food items. What do you think, Tassie?
And also just the other thing with that, what's really important for pet bird owners to recognise is that the meal size of their parrot will be 40 grams. So we need to consider that when we're making up the meal, how much of the fibre or the insoluble fibre goes into that 40-gram meal. So even for that breakfast meal, we would recommend most of it to be their soluble fibre, and then during the day they might have just 5 grams of the more fibrous foods. We don't want them to engorge on that, because that's what's going to slow the digestive system down.
So we're trying to balance the nutrition of the diet by organising proportions of each food. Now, a fresh food diet is going to be nutritionally deficient in certain elements. But we can't, our view is that we can't give Eclectus parrots pelleted foods. The reason for that is that it's a dry food, and as all Eclectus parrots know, when you feed pellets, the bird will go and dunk it straight in the water to soften it. And that's because the basis of digestion in the Eclectus parrot is the high water content of the fruit pulp. So the high water content means that the diet in the wild is nutritionally dilute, which means that the bird has to eat a lot more to get the nutritional balance. Yeah.
Makes sense.
But in the book, there's a big section on diet and a lot of pictures of how you balance the diet.
Very well done. Yes.
Yeah, and so it's very practical. Yeah.
Yes, that's great.
Yes.
I think that's
Um,
what a lot of people
Can
need.
I, Rob, before when you and Talia talked a couple years ago, and my memory could be bad on this, but I also think that you guys discussed the use of pear.
Yes,
Um,
pear. Yeah, pear is the pear apple,
For
right?
the pectin, for the
Um,
pectin.
For the pectin, exactly right. Plus, it's a soluble fiber, right? So if you cook pear, it goes translucent, right? Indicating that it's filling up with water, and this high water content of the diet is crucial to healthy digestion.
okay, so you're talking, so I guess I missed that from before, is that you're cooking these, both the
Yes.
pear and the apple. I missed that.
Yeah,
Yeah, me too.
in the meal, we tend to cook them, but they can have it if they're having that as their foraging food through the day as well. They can have it raw, as long as we have that at earlier meal. That gives them that lining of the moisture. That's what we're looking for.
The key meal of the day is the morning meal. That kickstarts all the natural biorhythms of the bird. So what it does, it kickstarts the digestive function, then kickstarts all the behavioral attributes of the Eclectus parrot, which are flying, bathing, and things like
And the
that.
foraging, which happens during the day, which is generally when the owners aren't there. So that's why we like them to fill up early in the morning with the bulky foods.
So if a bird was brought up a different way with not the right, best kind of nutritional support, is that fixable?
Totally right. The bird will want to eat this food. That's the trick about this.
There you
cook
go.
this food up with an Eclectus parrot, it will see that, and its natural instincts will come in. It will go to that food very quickly. Is that your experience?
Yes,
Jess?
yeah. So
Do you
they
see
can
that change the feather quality too? It affects the feathers?
Totally right. Because what happens when you have a diet which is incorrect and you've got a gastrointestinal motility disorder, which you would often not notice, right? Other than you'll get dry feathers, right? You'll get dry feathers, a feather color which is dull or washed out, right? Because they're not absorbing the nutrients they need to start with because the gut's not working properly. But also, Tassie, because they're not bathing properly, isn't it?
Yeah, so with Eclectus, we do like them to bathe as often as they can. We find a lot of pet bird owners that come to our clinic, their birds like to go in the shower with them, or they also like to use their water bowl if there's a decent sized water bowl in the cage. And most of these birds, because it's quite warm here in Sydney, it's temperate, they'll bath all year round. They'll choose to do that. So that's an important part of their skin health and their feather health.
We know that because, Susan, in this book, there's a big section on the preen gland of this bird, and it's got the most extensive preen gland tuft feathers of any parrot that I've seen. It's quite beautiful. There's a big picture of that. I gave a paper on the comparative preen gland tuft feathers. You might not have seen it, but it's quite an esoteric paper because no one's ever written about these preen gland tuft feathers.
Well, Lucas and Stutterman, they did the definitive thing with the preen gland and the poultry. So you're going to be the definitive guy on the when it comes to the preen and parrots and citizens.
I think you'll love the pictures there because you're a gross anatomist.
The anatomist, of course, I'm going to love the pictures.
I sent her a glimpse of a couple of pages today. Yeah, yeah. So if the Eclectus eats a lot of fruit in the wild, that doesn't necessarily mean that's the same thing that translates to captivity, right?
No, exactly right, because the rainforest fruits are high nutritional fruits, a high variety compared to agricultural grown fruits. They're so much superior. What we have to do, we have to match the nutritional content of those rainforest foods with foods that are agricultural grown. And that's why we've chosen these certain food types as core foods. For example, the pumpkin, there's the sweet potato are core foods for the nutritional value of those foods. It's all the cooked food diet or the fresh food diet is carefully calibrated to provide the nutrients that we need, but they are still lacking, Susan, in minerals. They're lacking in zinc, magnesium, key elements of the diet. They're also lacking in fatty acids. So what we do is we try to incorporate some seeds. Now, we do incorporate sunflower seeds in the diet for the fatty acid balance, and things like that. Also, some B vitamins like thiamine is deficient, so we need to add those to the diet. And and that's the trick, Susan. Fortunately, we've developed our own food supplements to balance the nutritional content of this fresh food diet. And I think previously it's been difficult to sort of balance these fresh food diets without food supplements because they're not really readily available. And I think that's why the push for pellets has been there for a while. But this gives you a different idea of how we balance the diet of a fresh food diet. So
Rob, would you say here in America, could you take a little bit of the pellet and make it act as a supplement that would be mixed in as a wet thing to my sweet potato type thing, or would you just say nope, you can't, that won't work?
Well, you can do that. It's a good question, because how are we going to balance this diet in America, right? So, and that's what we need to answer. The key elements that need to be attended to, the minerals is a key element, right? That's pretty easy because they've got racing pigeons over there, and they develop all these mineral supplements for racing pigeons. And so you'd reach out to the racing pigeon fraternity, and all of these things are made in Belgium. We've also got distributors of our products in America as well, and they're readily taken up.
What is that? What is that called? So people know what that is. Your products are available in America, you said?
Yes, they are, through Goody and through Lorraine at
Lady Goody and Finch.
Lady Goody and Finch. Okay.
Yeah. So in the 90s, I did a lot of work with the Goody and Finch in Northern Territory. Did a lot of wild work research there, and investigated the air sac mite in Goody and Finches, and we developed a product which is quite well known around the world to cure that disease and control it. In that time, we developed a supplemental plan for the Goody and Finch, which we then applied to other parrots. So Lorraine has had these supplements for how long now?
More than 20 years.
I'd say it's 25 to 30 years. So it's quite a long time. And she's a really lovely lady. And you remind me of her a lot.
What's the name of the supplements? Any particular ones? I'm sure she's got.
There's 7 products which we use. Yeah.
And does she distinguish them as for Eclectus?
Yeah, she does. Yeah,
okay,
yeah.
Great.
And
awesome.
and there in the appendix of the book, it describes these products as well. Yeah.
Perfect. So a lot of times veterinarians, we hear all kinds of advice from for Eclectus. All pellets, no pellets, all fruit, no fruit. I mean, fruit has its downside to some extent, right?
So when we're talking about fruit, when we're talking about fruit, we're actually not talking about fruit with the captive diet. We're talking about nutritional rich vegetables, right?
Okay.
So we're talking about the sweet potato, the pumpkin, the carrot. Right?
Less fruit or vegetable.
Yeah.
Okay.
And importantly, we're talking about, to get the protein balance, we're talking about legumes, right? So we're looking at legumes. We marry that with rice. So the protein of the content is balanced perfectly by a combination of equal parts of legumes and rice. So that gives you the complete amino acid balance that the bird needs. We like to then add to that diet some other grains, right? So we add sunflower seed in limited amounts, but we focus on the small seeds like millets, like the budgerigar foods that we give as well. And Tailai might talk about that. So
the reason that we like to go with the small seeds is that it takes a lot longer for the parrot to enjoy the meal if it's a smaller seed, rather than just filling it on the sunflower. So we do a lot with millet sprays as well, where they're still on the spray, and that's a very engaging activity for most birds. Then we use the seeds in like Heidi boxes and things like that. But the ones that we use are generally hard acrylics. so that the bird can't actually chew into it, but needs to work out how to use it as a puzzle. So all things that are designed to allow the bird to have that extended foraging time, but using the seed as well as part of that.
So the foundational
brilliant.
diet is equal parts of pumpkin, sweet potato, carrot, legumes, and rice. So equal parts which are cooked up, right? Now you can freeze those, but what Tailai has explained to me is that owners of Eclectus parrots love nurturing their bird. That's why we have the parrot, right? So we don't mind cooking these meals for them. It's part of our daily routine, and that's the essence of having a parrot bird. And so we like to have fresh foods. Now, so that's the morning meal. They have a cooked meal in the afternoon, and during the day they have these small seeds and a lot of things in the cage. We have foraging cages that we pack out. This is when the fruit comes in, Anne, right? The fruit comes there. But we also have little bits of tidbits that we add to the foundational foods, but they're minimal. So these foundational foods represent 95% of the volume of that morning meal. 5% is of these the things that provide the micronutrients, and they're tasty morsels, aren't they?
Yeah, so they're things that the individual parrots might enjoy as well. So things like different fruits that are seasonal, pineapple, berries, all that type of stuff as well goes in there. But we do need to maintain that the size of the parrot meal is only the 40 grams per meal generally. So people need to consider that of how much of each proportion to put in there. So that's why we've gone at length in the book to mention the proportion sizes and what we suggest.
In the book, do you talk about different foraging apparatuses at all, or delivery?
Yes, it's a big section on that, on foraging.
Perfect.
Yeah.
Wonderful.
So the big mistake that people make is the proportions of the food. So they like to feed the little beautiful fruits and the greens, the leafy greens, and the bird will eat that first, but and then be denied of the nutritional content of the main meal. But more importantly, if they overengorge on the bulky greens, like green leafy greens, that will impact on the intermediate zone function. You'll get problems with the gut. Now, they may be temporary because the gut has all of these mechanisms to maintain its normal motility function, but over time, that will impact on the gut. And then once you get a gut problem, you get nutritional problems. So you get this vicious cycle. And then, yeah, so what you were talking about the opportunistic polygynandrous breeding behavior of Eclectus parrots. Now, what that means is that these birds will want to breed, have sexual behaviors all the time. Now, that's a big deal, right? Now, in the book, there's a big section on that. Now, if you can manage these behaviors, and Tailai has methods in there to manage those behaviors, we don't want to pump these birds with GnRH hormones to stop that behavior unless you've got an issue with it, like aggression. We need to do that. But again, in the book, we give you alternative methods of controlling these. But the thing is that the problem with those behaviors is that they lead to what's called a secondary vitamin A deficiency, Susan. Now, with no one's talked about secondary vitamin A deficiency in the veterinary profession. There's only one reference in human medicine about it. And what secondary vitamin A deficiency, which is probably the most common implicating cause of disease that I see in the Eclectus parrot and many other pet parrot species that have developed either male hypersexual behavior or ovarian hyperactivity. We introduced the subject of ovarian hyperactivity. Ovarian hyperactivity has not been recognized in the veterinary profession. It's a silent cause of secondary vitamin A deficiency, and it's complicated, but it's related to follicular genesis in this bird. There's a big section on this disease in the book, and ovarian hyperactivity in Eclectus parrots and female parrots of other species who have developed a sexual bond with their human owner are very prone to secondary vitamin A deficiency. Now, secondary vitamin A deficiency symptoms are exactly the same as primary vitamin A deficiency. Primary vitamin A deficiency means that the diet is deficient in vitamin A. Secondary vitamin A deficiency means that the diet, the vitamin A content of the diet is not enough to support the reproductive activity of these birds, and the liver reserves fall to marginal, which means 10% levels, or deficient levels, which is under 10%. But again, vitamin A homeostasis is very robust, and often you won't see the overt signs of these conditions other than long toenails, right? And especially a long upper beak of the male bird. Now, it's always intrigued me, or puzzled me for so many years. Why do eclectus get this long upper beak, the male bird, of the male bird? Why do they get this long upper beak? Now, a lot of people said because they're not chewing enough and blah, blah, blah. It just didn't make sense to me. Then suddenly it just all came together. Once I understood that they're prone to male hypersexual behavior, and then that male hypersexual behavior, because in the male bird, spermatogenesis, which is the testicle action of the to produce sperm, relies on vitamin A for its function. Now, in the wild, spermatogenesis is only lasts for 10 to 14 days. That's when the mating phase of these birds. So it's a limited period. In the captive situation, this is continuous all the time. Spermatogenesis is going on every day of the year, which
say what that is. I'm not sure we all know what that is.
Spermatogenesis is the production of sperm by the testes.
Okay.
So in the Eclectus parrot, what we found is that when a bird is reproductively active, the testicle enlarges to 18 millimeters. The normal dormant testicle is about 8 to 10 millimeters. So you can diagnose this condition by taking an X-ray and measuring the testicle. So male hypersexual behavior is often missed as an underlying cause of secondary vitamin A deficiency. And these birds are presented with symptoms of vitamin A deficiency, which include a wide range of symptoms and diseases. Now, in the book, this section it took me 2 years to understand the pathogenesis of secondary hypervitamin A deficiency and its implication with all of these other diseases. And so in this section, it's a very big section. It goes through all of the different organs which are impacted by vitamin A deficiency in the one chapter. So I would, for avian veterinarians, to read this section very clearly, and then you get a really good hold on this disease, which is being presented as other diseases. You see the symptoms of that disease. Now, if you want to prevent this vitamin A deficiency together with vitamin D deficiency, because most pet birds are kept inside, especially in America in winter, I'm very sure that they're prone to vitamin D deficiency. That impacts on the calcium levels in the body. Even though they might be giving calcium in their diet, they'll develop calcium deficiencies. As Susan knows, the gizzard function relies on calcium because the gizzard is a big muscular organ that requires calcium for contraction. You get a calcium deficiency, the muscles don't contract, and then you get gizzard failure, or what I call gizzard overload dysmotility, which then causes a nutritional deficiency, and then you get a vicious cycle again. So, and then together with vitamin A, vitamin D, calcium deficiencies, together with this pain associated with gastrointestinal motility disorders, you get a visceral pain and feather plucking. So that's a big story, multifactorial cause of feather plucking behavior. It's complicated. I've given you a chart in there. It'll drive you crazy, Susan, looking at this chart of how complicated this condition is. But the way we manage it is so if you've got a male hypersexual behavior and you're presented with birds which come in with a variety of symptoms, and you don't really know that male hypersexual behavior is the core reason for these diseases, for example, if we look at wing flicking or toe tapping, right? Toe tapping, which is a classic symptom of gastrointestinal dysmotility. It's been referred to as a lot of things related to excessive feeding of nutritional supplements. Well, that's not our understanding. If you give
Do you look at
vitamin A,
Do you look at it, Rob, as more of a pain? I've always thought of it as potential for pain.
yeah, it's what it's called. It's called myoclonic seizures. So it's in a localized form. So that's how we define it. It's a myoclonic seizure. Now, in budgerigars, you get myoclonic seizures, which are generalized. That means that the budgerigar will go and have these fits, and you've probably seen those. You give that bird vitamin A injection, and within 3 days, the fits will stop. So, what we've got is we've got an underlying problem that those birds will also have a vitamin D deficiency. So the combination of vitamin A, vitamin D deficiency will bring about, and calcium deficiencies will bring about these myoclonic seizures. Now, I'm pretty sure that the myoclonic seizures of African greys is associated with this. And so obviously they're getting a calcium problem as well, Susan, because I think that's the literature is pointing towards hypercalcemia as a cause of these. But with the treatment plan, I'd strongly recommend calcium, vitamin D, and vitamin A as a treatment plan for these seizures. So I think we have to differentiate. I think we have to differentiate myoclonic seizures from normal seizures. Yeah.
Can we go back to I want to make sure people understand and synthesize in a simpler summary. If a male comes in with a long beak, it's probably a vitamin A deficiency. So
It's not probably.
It is.
It's unless it's deformed, right? So if it's a long beak, so that's a sign of what's called chronic vitamin A deficiency.
Okay.
That means that this
liver problems, the long beak, but in for the male Eclectus, it's vitamin A.
No, that's true, right? Because let's go back to the liver problem. The liver problem is there because of a vitamin A deficiency impacting on lipogenesis. That means the movement of liver, the movement of fat through the body. So when you get a vitamin A deficiency, fat gets deposited in the liver and abnormal organs. That's why when you get a postmortem of a Eclectus parrot, you'll see abnormal fat around the heart. But the Eclectus parrot is less prone to liver problems than other birds. For example, the most common bird, bigalar or budgerigar, are very prone to obesity and fatty liver from diet, but it's not diet. These birds have vitamin A deficiency. If we look at the budgerigar, it's an opportunistic breeding bird as well. It's these birds that have opportunistic breeding behaviors that are most prone to vitamin A, secondary vitamin A deficiency. So the way you manage these birds is with vitamin A plus diet plus increasing the exercise. But Eclectus parrots are far less prone to obesity than other birds. But what they're prone to, Susan, is these granulomatous xanthomas in the abdomen. And so, but that is an end stage of chronic vitamin A deficiency. You just can't help those birds. In the early stages, you can. So if you've got a bird with a long beak, it's going to take a long time. That's chronic vitamin A deficiency. That bird's had that vitamin, it's called chronic marginal vitamin A deficiency, secondary. In the book, I've defined each of these different forms of vitamin A. But it is really revolutionary in how we manage these birds. The information that we've worked out will change the way that we manage these birds and really understand the mechanisms of the development of a lot of diseases, which apparently appear to be unrelated to these nutritional problems.
So, Rob, when you fix the A, let's pretend you.
How do you fix the A? Do you give it?
Well, he's doing it with his sweet potato and carrots.
No, we're not actually. Initially you have to give injections because these birds have gastrointestinal motility problems that can't absorb vitamin A. So initially you have to get, the aim is, as you know, Susan, the liver is a store of vitamin A. You only get vitamin A by giving food naturally. What we have to do, we have to bypass the intestine to get control of this deficiency while we get control of the digestive disorders. And we give injections, and we've got dose rates of those injections. A lot of people are fearful about vitamin A injections because of overdose. But if the bird's got a deficient, it's got a liver stores of 10%, you can up the dose rates dramatically. You only get side effects when you're giving vitamin A injections when the liver reserves are full of vitamin A. So, so
What is
what
the
we're doing,
dose? What is the
and
dose
then you
recommend?
get overdose, you see. But you have to, it's easy for me to know how much to do. For veterinarians, you have to be very careful with vitamin A, because often it's incorporated with vitamin D injection. So you have to get the balance right. So although we're very careful here, and what we like to do is we like to give vitamin A, D injections each week, rather than each week for 3 to 4 weeks to get the liver reserves up. Now that won't get the liver reserves to 100%, but it might get them to 50%, which then gives us a chance to stabilize the gut function. And then we support the vitamin A needs with the vitamin A supplement. And we use a concentrated vitamin A supplement that we can put in the food or in the water, whatever. So Susan, that's how we manage the vitamin A's.
I
Now,
see,
with
because we also, the type of products that we had as injectables for the vitamins in America have kind of, my understanding is most of them are no longer available.
Well, I have to get mine from Singapore. So
there you go. Yeah. Yeah, because
so-
ours are gone. You know, we used to use those all the time, like you said, and it was interesting. You would give, you know, I don't know if you had Ingicom, but it was vitamin A, D3, and
Yes.
E and then calcium, which is exactly what you're talking about.
Yeah.
And even if the owner never gave the antibiotic, the bird got a lot better.
Yes,
Remember
exactly
that?
right.
40
Yeah.
years ago? Yeah, there
That's
you go.
right. Yeah. So that was my introduction to Eclectus parrots 40 years ago, right? And I had the injection, and the owner thought I was a genius, but I didn't know how it worked, did we? At that stage. Now I know how it
Exactly
works.
right. Exactly right.
Yeah.
Because it also, I know, and I don't know the mechanism, and you probably do, but I've been explained that before about how it affects the immune system.
That's right. So in
And
the book, I've got a big
there's
section on
a whole complex thing of how it makes it better, and I can just say that it does.
That's right. So the vitamin A, and in the book, I've explained all of that for you. It's really remarkable. And vitamin A and vitamin D work together for the immune system. When you get these, I go into what we've talked about is what's called opportunistic versus opportunistic infections. Most of these infections are opportunistic. That means that's why we get Pseudomonas in sinus, and we keep on chasing it with antibiotics. You'll never win with antibiotics. You have to bring the vitamin A and the vitamin D in, and then you'll stimulate the immune system to get rid of those opportunistic infections. So in the book, there's a big section on that, because and it's quite remarkable what vitamin A activates. The main thing that it activates is the differentiation of mucus cells, and the mucus cells in the nose is the key thing to healthy sinuses. So we're restoring that natural immune defense mechanism in the nose. But it's quite weird because you get these in the choana, we get weird infections down that, as you probably know. Another thing that hasn't been really mentioned much is the cloacal health. And in the book, and you understand the essence of cloacal disease, but I don't think much attention has been paid to how we can use cloacal symptoms as an indicator of certain diseases or metabolic diseases, because that's what we're looking at. We're looking at chronic metabolic disease with a lot of these birds with chronic vitamin A deficiency. Once you get these chronic metabolic disease, you're with an uphill battle to try to control these. That's why we're trying to get an understanding of these problems and make sure the diet's right from a young age.
I assume we've talked about cooking food, but I assume we're not feeding it warm, since that would exacerbate the reproductive.
I think that's a mistake. It has to be fed warm. Tailai?
Yeah, so we like to feed the food warm. The temperature in the rainforest is warm, so when the collectors are eating in the wild, the food and what they're eating is warm. So we do recommend to feed warm. We find that the birds eat a lot more of it when it's warm rather than when it's cold.
You don't think that starts the whole reproductive cycle
No, the reproductive cycle is there anyway, right? It's not stimulated. It's a little bit different from
Other
seasonal
species?
breeders. It's different from seasonal breeders like cockatiels, right? With cockatiels, that is important. With
Right.
Eclectus parrot, it's gonna this reproductive
They're already
behavior.
horny, huh? So,
Yeah, it's gonna happen,
Yeah.
right?
yeah.
So
yeah.
what we want to do is we want to manage it primarily with diet, right? So we want to up the vitamin A levels in the diet to prevent the consequences of this behavior. Now you're going to get behavioral issues with it, and that they're attended to in the book as well. Tailai's done that whole section, how you do it in a positive way, which is, I think, energy, isn't it?
Yep, so we like the birds to use up a lot of energy. That's the main way of handling any of these sort of behavioral problems, redirecting energy. So we don't like birds to be sedentary. We don't like birds to be happy just to stay in their cage. We want them to be outgoing, interacting with not just that household, but going on outings and things like that. So there's a lot of information in the book of how to get your bird more active and more interactive. So it's more of a social environment that we like to provide rather than just one-to-one contact.
So there's a big section in the book on behavior. Now, Susan, I don't know about you, but I read a lot about behavior and I just couldn't make sense of it, right? So, and then I talked to Tailai and she said, look, it's pretty easy. You just have to think like a bird, right? So, but I didn't know how to think like a bird, but she's taught me how to think like a bird. And so her section is, I just don't think, without Tailai, I couldn't have worked all this problem out, all about problem about behavior, all about feeding. You have to have a new mind, Susan. You can't have our minds, which is very structured. You have to think outside the box. And so,
Right. And I think that's, you know, as humans, we've always wanted the bird to interact based on us. And what you're trying to get us to do is to realize that we need to interact and learn to interact with them.
we have to behave like a bird.
Right.
And that's really hard for humans to do.
Right.
And so Tallie's she's redirecting us to think differently. And I would agree with you, Rob. We don't do that very well, regardless of if we're a vet or not. But vets are probably worse at it.
Yeah, and the main thing that we have to consider as well in this is the relationship, not to change the relationship for the owner in such a way that the owner's no longer getting their benefit from having the bird. Yes, we're focusing on the bird's needs and how the bird needs to interact, but we still have to maintain that if we change too much, the owner is going to miss out on a lot of what they find the pleasure of having a parrot as well. So that's what we have to balance out. The pleasure for the owner and the happiness of the bird at the same time.
And that's the essence of our ways of treating these birds. It's not saying don't do this behavior because it's going to stimulate sexual behavior. We're not going to stop that sexual behavior. We just have to control the consequences of it, because without touching the bird and loving the bird, there's no real. And I understand this because initially I followed that paradigm as well. I followed that paradigm of saying, look, don't touch your bird, blah blah blah. Keep it cool, blah blah blah. You know, don't interact like this. Well, that's not what it's all about. So what we've done, we've changed our approach to these. At times, we do need to give implants. There's no risk about it. And the reason, the timing of the implant is to control the reproductive behavior while we re-establish normal gut function, right? We have to do that to prevent feather plucking behavior. So we have to do that, and we may have to do that for two years whilst we get the normal molt going. Now, in the book, there's a big section on the molt. The natural molt of birds isn't much of a topic in companion birds, but with my background with racing pigeons and with budgerigars and things, it's a big deal, right? And so more attention needs to be made to the molt in these companion birds. And there's a big section on the molt in here. And because if you get a delayed molt, because with these birds with hypersexual behaviors, as you know, the molt and breeding behavior are mutually exclusive. So what happens is that they hold the molt off, right, with their reproductive behavior, which means you get an old feather, which is prone to breakage because it's old and dry. And that breakage then promotes what's called feather damaging behavior and then leads to feather plucking behavior. So, and so that's why we use, when a bird comes in here, I look at the molt, and what you have to know is you have to know what the natural molt, normal molt period is, which we know in the Eclectus Parrot is the summer molt. By March, which is first of autumn, by the 1st of autumn, all Eclectus Parrots should have all their primary flights up to 10. If they have a delayed molt, that indicates that they've got a sexual behavior which is impacting on the molt. And so that's the first thing you look at. So if you see that a bird has a delayed molt, you have to think it's got gastrointestinal motility disorder, and you need to investigate that as a key element of the presenting complaint.
Somebody wanted to know about corn and
Corn's
about rice. Corn is great.
Corn's great.
Rice, do you recommend brown rice over white rice for?
We like white rice for digestive function. You can give brown rice as well, but the white rice is the rice that takes that water content on. So that's why in that bulky morning meal, and then again in the evening meal when we feed the legumes, we like to combine that with the white rice. But brown rice is definitely okay as well, just not the same digestive function that we get from white rice.
So with the corn, we don't want corn as a major food. We need to balance it as well. So if you gave cooked corn to these eclectus, they'd eat all of it at once, right?
Any
so
bird.
You have to limit the amounts, and we put that as a treat on top of the foundation diet, and it goes through that in the book as well. The book's very instructive, right? It goes through the amounts, the proportions, and you just have to read. It's like a recipe and explains why. So it's a very readable book in that area. It's, as you know, Anne, you've looked through, it's very beautiful, but you have to go beyond the beauty. You have to read it.
Well, you know, some people, it's a bumper sticker society we live in, you know, so sometimes having that picture of what to feed is very helpful.
Yeah,
Some people are not gonna, there are a lot of words in that book, and they're little letters. So sometimes you need that summary. Yeah. Somebody wanted to know why you suggested that the foraging items not be things they can destroy, like cardboard, etc. What's
they aren't.
Oh, with regards to the papers and things like that, we don't recommend that because those fibers are very difficult for the eclectus to break down once they're inside the stomach. So even
why would they swallow?
Because this is a problem with development as youngsters when they're not put onto those weaning foods from the 2 to 3 weeks onwards. They don't actually learn what is food and what's not. So sometimes they might even have a mineral imbalance or something like that, and they're looking for those minerals. They'll chew on it and swallow it, but other times they're just actually not aware that this isn't a food. So they're used to their human.
Yeah, I've just seen them destroy it. Yeah. Okay.
Yeah. The other thing
they'll ingest it. That's your concern.
Yes. Yeah.
The other thing, Anne, is that a lot of these birds have problems, gut problems, which impacts on their brain, and they accidentally swallow these things that they chew. What we've found is once you fix up those nutritional deficiency, the brain functions better with the gut function, and then they differentiate between food and non-food. For example, you can give hard objects like wood and things to black cockatoos, white cockatoos, as long as their gut function is good because they've got a good, strong gizzard. But with an Eclectus parrot, which has a different gut, they can't have these items because they have to pre-digestion them in the intermediate zone, and the intermediate zone is not made to pre-digest hard food. And so that's where you get this really active inflammation in this area, which causes acute pain. So it's a combination of things. Is one, they haven't been taught what is food and non-food, plus the impact of brain function, recognizing that this is not food and then accidentally swallowing it. So, and then you have to separate it between different species of what you use for different foraging foods. Yeah.
Right. And so nuts are hard. So you recommend little to no nuts, right?
Eclectus can't have nuts, right? It's a
I just
no-no.
want those,
Right.
I want those key bumper sticker messages to.
Yeah, no, that's the main
No
thing.
nuts. Yeah.
Yeah,
Nuts
no
don't
nuts at
help.
all. Yeah,
Right.
but they can have fat foods like sunflower seeds in limited amounts, right? And you can use those as a training aid, but you can't have nuts.
Okay. And how do you feel about probiotics? Is that helpful or
Right.
not?
Probiotics are great, yeah, but you're chasing your tail, right? Because you're not attending to the core problem, right?
Right.
So,
Right.
but if you've got probiotics are working because you got a gut dysfunction, you see? So you
Right.
have to look a bit further, work out what the gut dysfunction is, get them onto a good diet. We use what's called prebiotics rather than probiotics. So we use prebiotics to feed the healthy bacteria. We find that's much better in the Eclectus parrots than the probiotics.
And what prebiotics do you recommend? Is that one of your supplements from Lady Goulian?
No, you can get prebiotics in America. Yeah.
What,
So,
any particular kind though? Because
no, we don't.
talking about human grade, I don't
Lorraine would know that. Yeah, Lorraine from
at Lady
yeah.
Goulian.
Yeah, she'll know.
Okay.
She got all that information. Yeah.
Okay.
So,
Because the human probiotic, prebiotics, I would assume are completely different from the birds.
no, it's very true. They'll be bird-based prebiotics. But
Okay.
yeah, that's right. There's specialized prebiotics around. Probiotics are confusing. I'd probably move against probiotics because they've got a lot of bacteria in there that you don't really know what's happening, and it will irritate the gut. The other thing is that someone had to mention that, right, with the legumes, we're talking about the beans and legumes. They're cooked as well, right? So they're not dry.
Not
They're cooked.
sprouted or, right. Right. Soft. They're made soft.
Yeah, and again, we have to look at the proportions. Yeah.
Hmm. Can we use pumpkin seeds for training, since pumpkin is a valuable thing? You know, training is sometimes little bits of things.
Oh yeah, for sure. We've got
Or use something a bit smaller just so that you can get that training like pretty quick what the bird's responding to. That's the only thing. So
Okay.
a lot of our owners will cut up a grape into really tiny pieces, and that's the only grape they eat for the day, because we don't want them to fill up on multiple grapes when we know that their system can only tolerate a certain amount of food. So yeah, we cut things quite small for the training.
There's a lot of questions about bathing.
What's
Is there any particular message? Say again?
A method for bathing? Yep. So
A lot of questions about bathing. Did you have any kind of core messages about bathing that you'd like people to know?
We like the Eclectus to start bathing from a very young age, and birds that are quite what would you say, confident, will often bath in their water bowl. The other birds that don't like that, they can be introduced to the shower. Is generally a little bit what birds feel more comfortable with, because they're on their own rather than a spray bottle. Some birds will tolerate the spray bottle, but the spray bottle is something that you have to introduce a little bit more slowly, get them used to it. And often I recommend, if people are using a spray bottle, that you want to spray yourself rather than the bird.
Yeah.
So
or up in the air and you don't want it to be a negative experience. Right.
Yes. Yeah.
The key thing about bathing is it has to be done in a warm environment. The Eclectus won't bathe if it's under 15 degrees. And so there's different sorts of bathing as well. So they'll want a complete bath at least once a week. They'll do their head bath and do their neck daily to clean their face and things like that. Bathing is a sign of good health. The reason that we want to promote a lot of bathing is that it expends a lot of energy. And so this is the structure of the day that we use to prevent boredom type behavioral disorders.
Mm-hmm. Somebody asked about, they have your book from 2004, I think it was, and they wanted to know if you've changed your mind on anything in the last 20 plus years.
Oh yeah, totally right. We just had a little note there that they eat nuts in the wild. Well, they don't eat nuts in the wild. We've done that. So what you've got is you've got a lot of information about in these books that they eat nuts and fruit and things like this, which are generic, right? Eclectus do not eat nuts in the wild. Nut is defined as a fat-based fruit They do not eat any fat-based fruits. There are fat-based fruits that they eat, but they don't eat the nuts. They eat the flesh around those nuts or the skin of those nuts. Now, all of these fruits are detailed in the book, and the pictures of those, and you'll see those, because what we need to know, what we need to emphasize here is we use the wild diet, the diet that we found in the wild as a basis of what we feed in captivity to prevent these really important issues of feather plucking behavior and diseases. So that's why I'm very strong on this. And there's a lot of things, a lot of information out there which is not correct. We're pretty good at with this bird now, and I can be forthright about this.
So somebody who has your 2004 book should still buy your new book because you have.
Oh yeah, the 2004 book. That is
what
like
changed. Yeah.
That's like kindergarten.
Okay. Yeah. Well, the new one is definitely not kindergarten.
No, this one, but the new one is readable. I can tell you, it's very readable because I read a bit the other day and said, "Who wrote this? It's pretty good."
Well, I can't imagine how you had time to write so much, but I can see why it took 20
I'm a bit
years.
like Susan. We make time, don't we, Susan?
Yeah. So, Anne, can you tell people how they can order the book?
I think Melissa has been putting that in the chat.
Okay.
But
All right.
just to verbalize it, so people listening to this recording later, you go to our online store, which is helpingparrots.com. Now, shipping overseas is a totally different question that
there's a distributor in UK.
Okay.
There's a
Who
distributor
is
in
that
UK.
for anybody listening? Do you know who?
I think they're goodyanfinch.com, but I'll just double check.
No, it could be, yeah, that's right. Yeah, but it's on our webpage where you can get that. Yeah,
And your
yeah,
webpage is so that people know.
birdhealth.com.au.
Okay, there
Yeah.
you go. So anybody who's listening to this recording later knows where to go to find a way to order the book.
Yeah.
Because I think we're
Susan,
restricted to this.
Susan, would you have time to read the book in a few hours and then do a review for me?
A few hours.
No.
5 lifetimes. It would take a lot of lifetimes to read that book. It's a reference.
No, but I would like to review it.
We'll make sure that you get a copy.
Because I think, Rob, that you've done a tremendous amount of work. And I'm going to say this sincerely, that's been underappreciated by the avian veterinary community. And it would be nice for someone, and maybe me, and I'm not in the know group so much anymore, but for the journal, they will review books, and I will ask if I can't, if someone will.
Yeah, I think when we broach new ideas, it's difficult in any profession for people to accept, and I think you'll find that with this book, it's a completely referenced book. It's referenced, and it's got very good information in there, which I think you'd like.
Yes, well, I have referenced a lot of my talks, particularly in herbal medicine, and included the references, but still people like blah and blah will say, oh, but there's no references on herbal medicine and therefore it can't exist.
Yeah.
If you don't read the references, blah and blah, then you won't find that you don't know.
I think what we're looking at, Susan, is integrative medicine, which is what you and I do. We incorporate Western medicine with other forms of medicine, trying to get to the core causes of these diseases and manage them from the beginning, rather than chasing the diagnosis, making a diagnosis, then go straight to medicines, which is the wrong way of doing it.
And you know that I've been very, very interested all along in behavior and nutrition.
Yes.
Even though I didn't understand it either. And I never had a behavior class.
No.
Yes, you did. We taught one at your clinic. Yes. Yeah.
Okay. Thanks very much, Anne.
Thank you. It's been a real privilege to see you guys again, and keep up. I don't know when your next book will be out. I don't think there's anything more to say, frankly. I think you've said it all in this book, but we appreciate the honor of being able to promote your good works and to sell the book. Yeah.
Thank you, Anne.
You too.
Have a great evening.
Thank
You
you.
too. Thanks,
Well done.
everybody.
Bye-bye. Bye.
Bye.